Welcome back. Now, every other Thursday, we're taking a look at a health issue or concerns that are affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic, which is checking your blood pressure. And doctor, from what I was understanding, it's also called the silent killer, right?
It is. High blood pressure is one of the major risk factors for both heart disease, which is the #1 killer both in Hawaii and in the United States as a whole, and stroke, which is the #3 killer in Hawaii. So high blood pressure, although you can't feel it much of the time, is certainly a risk factor that we should control on a regular basis so we don't get a stroke. Once you have a stroke, it's pretty serious.
Okay, so you talk about people doing the home blood pressure. Why should they be doing that?
Doctors are recommending patients do home blood pressure monitoring more and more frequently these days. The reason is there are home blood pressure monitoring which are more accurate than the doctor's office. There is a disease called white coat hypertension, which is basically where the patient goes into the doctor's office, everybody's wearing a white coat, the doctor's office causes anxiety, the blood pressure goes up 20 points more than it ever is at home. And also there are other blood pressure diseases where the blood pressure is lower in the doctor's office, such as masked hypertension, than it is at the home in the accurate way. Now, there are actually doctors who develop computer programs, and you take your blood pressure and the blood pressure comes into the doctor's office. But you can also go to a drugstore, your friendly neighborhood drugstore or medical supply shop and get a blood pressure cuff and take your blood pressure and write it down, and that's a low expense alternative to the high expense computer recording.
So if you're at home, what do you need to read your blood pressure?
A blood pressure cuff, which is this.
Okay.
And in addition to the blood pressure cuff, a set of ears. We call this a stethoscope. And so sphygmomanometer, which is what this is, the cuff, and a stethoscope.
Now, you told me to take off my jacket because you're going to see if I actually have a heartbeat.
We're going to check for your high blood pressure. And we had that question, Ross, earlier today. I hear my heart in my left ear. Well, this will be a way of hearing whether your blood pressure is too high, and that's causing the noise.
Now, can you explain to everybody out there what masked hypertension is?
Yes, masked hypertension, Ross, is when the blood pressure is actually higher at home than it is in the doctor's office. It's the opposite of white coat hypertension. And so the blood pressure at home is probably more accurate if taken frequently enough to give us an estimate of what we should treat with medications when we have the disease high blood pressure. I, for example, are on a blood pressure medicine in the morning and another one in the evening.
All right, can we do the blood pressure check? What is a normal blood pressure for most people?
Under 130/80.
Okay.
So we put the cuff on, your hand goes up. That's right.
Is there a heartbeat? Some people say I don't have a heart. It's cold.
And we're going to have you hold this.
Okay. Now, how often should people be taking their blood pressure?
Probably about twice in the morning and twice in the evening. Blood pressures in the morning, early morning hours rise, which causes an increase in ER visits for stroke and heart attack in the early morning hours.
Okay.
But blood pressures in the evening are shown by research to cause risk factor for kidney failure over the course of time, as well as heart disease.
Okay, and apparently your blood pressure can go up and down through the day, depends on what you're eating and so forth?
That's right. And Ross, let's take a test.
Okay.
I know you know the answer to this. What causes a high blood pressure to go up with diet?
Let me see, it has to be salt, right? MSG?
You got it.
And exercise, of course, increases blood pressure, I would think.
It does temporarily, but the cumulative effect of aerobic exercise is to decrease your high blood pressure. So aerobic exercise and weight loss, if appropriate, will help decrease your blood pressure.
Is there a heartbeat there? Can you tell
There
anything?
is.
And then is that anything under 130 or 140?
130 over 80 or less.
Okay.
And yours is just fine.
Okay, so I got an okay blood pressure. Thank you very much,
126 over 76.
Ooh, stress also causes, right? TV causes?
Everybody has stress.
All right, thank you very much, Dr. Kalani Brady, breaking it down. Coming up next.